We're a 200-bed community hospital, about 11,000 discharges a year, somewhere in the neighborhood of 40,000 ER visits annually, and about 175,000 outpatient visits annually.
Initially, when I signed on, we were pretty much essentially paper charts and paper progress notes. And then last March, we started rolling out CPOE, and I was one of the first physicians to go live with CPOE.
Knowing that we wanted to implement CPOE in a full EMR over the last few years, we're just looking for a mechanism to improve the way that our physicians would engage the system. In our old environment, each workstation that the physician sat at, so if they went nurse station to nurse station, they would have to retrain Dragon to use that workstation because each physical device is a little bit different. We've built a one-to-one relationship through VMware that helps them always have the same look and feel wherever they go. Regardless of the physical device that you log into, you've got your computer available. There's no data stored, no drives, no memory storage on these devices at all. From a HIPAA perspective, it's fantastic for us. We currently have a combination where physicians will bring in their own devices and iPads, and then we provide for others also. In fact, that's all I travel with anymore is my iPad, and as long as I have internet connectivity, I've got my full PC if I need access to it. Our final solution here is this integrated all-in-one zero-client device. Very few cables, really clean look, and we've integrated the RFID reader in the back, and so that interaction with the Teradici firmware on the workstations uses Imprivata right away off the top of that. We did a study a few years ago, between 6 and 8 passwords for a clinician to log into the different applications that they used all day long, and so we were trying to remove another barrier to acceptance and engagement from the clinicians, and single sign-on is a perfect fit for that.
30 seconds adds up if you keep doing that throughout the day. And as I'm sure you've heard, doctors are quite busy, and so just trying to save those 30 seconds here and there, it really does add up. So basically what I do is I open up the chart at the nurse's station and the dual monitors so that I have the Dragon available if necessary for documentation purposes. I have PACS available, up to date. Any of those things that need sign-in, I'm already logged in, and it's great. And then I go and see the patient. Now the patient has questions, or I decide to order something at the patient's bedside. I just tap my badge, and then it's right up. It's already pulled up onto the screen.
Before we started doing the swipe with the cards, it was logging in and logging out with your name and password every time you would go into a different room, a different computer. And so now it's much easier since it has all of our passwords accessed, and as soon as we swipe, it logs us in. We don't have to keep retyping our name and password.
I really like the computer program that we're using. I feel very comfortable with it. Then so do the other physicians. Now all of my hospitalists are 100% CPOE.
We've been able to craft together that combination of using the VMware and the virtual desktop tied together with a single sign-on so that it's one seamless solution. They just walk up, tap in, do their job, and tap out, walk away. And to them it is seamless. To us, we understand the technology behind it and why it's powerful and what we're able to do with it and how it's secure and quick and easy to use.
A year and a half now into it, I've had someone challenge me to say, I think I'm still faster in paper, and I said, I bet you you're not. Bottom line, I think using virtual screens and single sign-on has been better for the patients, which is ultimately why we're here. We're here for patient care.